So I want to talk a little bit about the manufacturing, the distribution of this appliance. So the appliance is actually made in a lab that I own, for full disclosure, and the lab's called smileperfected.com. And we manufacture the appliance for patients and dentists worldwide. So how do people find out about us? Well, obviously, me being on the doctor's show on CBS garnishes an enormous amount of attention, and patients typically find us from there. We also do a lot of SEO, search engine optimization, and AdWords. And we get the word out worldwide, and we're number one in Google search for Tourette syndrome treatment, Tourette syndrome appliance, anything related to kind of Tourette syndrome. We're typically number one on all of these search engines. So patients reach out to me all the time, and usually it's a mom who's at wit's end, who is passionately trying to take care of their son or daughter. And one of the things that I had CBS do is publish my name and my personal cell number on their website. And for those listening, my cell number is 954-683-2693. I'm more than happy to talk to moms and dads about their children to see if we can help them. Sadly, the divorce rate among Tourette's families is close to 90%. It's horrible. Typically, dad leaves and mom's left at home to try and take care of a child who is suffering. A lot of these children have such a difficult time that they usually get taken out of school. Mom has to homeschool them. Generally, she doesn't really have the skill set to do that. The passion, yes, but not necessarily the skill set to try and homeschool the child, and it becomes just an escalating problem. So by the time they get a hold of me, they get to talk to the guy that was on television. They're always amazed when they call me and I answer my phone, and I talk to them and I give them, as much information that I know to try and help them. What we were able to do is there's dentists on the internet who advertise a similar type treatment, and they're charging patients between $10,000 and $12,000, which is horrible. Wow. The cost of an appliance we sell for $350 to the dentist, and then the dentist will add on top of that their office fee, which is typically between $500 and $800. So we can treat these patients for a lot less money, and we do it with an appliance that was studied and published in a peer-reviewed journal, and that's how we do this. So what's involved? You need to find a dentist, and everybody says to me, well, you have a dentist like in Austin, Texas, or Sacramento, California, or Kansas City, Missouri. And I don't really know dentists all around the country, but what I always tell mom and dad is we need a dentist who cares. And it's not to say that a dentist who doesn't want to make this appliance for the patient, he or she may care, but quite frankly, it just may not be in their bailiwick of things to do. So what does it really mean? So dentists are busy during the day, and they're drilling and filling, and they're making crowns, and they're doing all kind of good stuff. And sometimes dentists are so busy, they just don't have time to add a new procedure or a new protocol to the treatment of their patients, or they typically don't treat kids. So you take a guy like me, when I was practicing, I normally would never see children. All my patients were older. So what does it mean to have a patient and a dentist have a relationship, and the dentist to care? We need to have a dentist who wants to learn something new, and we need to have a dentist who wants to spend the time required. So what does that really mean? Well, in children's cases, they don't want to tick in public. They realize it's very unsettling to those around them. So when they go to a dentist's office, they do everything they can to try and suppress their tics. So one of the things we need to do is we need to know how many times they're ticking per 2-minute interval. And if they go to the dental office and they're trying their hardest not to tick, it becomes counterproductive to the whole entire thing. So what I tell dentists is, I'm going to teach you how to do this. You have to be willing to see the child or the adult at the end of the day, so that they can be in an office without any other patients there, so they can feel free to tick. So what's the process? Well, the process is this. The child sits in the chair, they kind of get acclimated in the dental office, and typically mom, who's going to attend the visit with the child, she knows what the tics are. Most dentists, most lay people don't understand what tics are. Tics can be something as simple as blinking faster than what we consider normal, turning your head a little bit, rotating your head, clearing your throat, touching your ear, touching your face. These are all like tics. These are all involuntary. And mom knows it. She knows the tics of her child. So she would count the number of tics without anything inside the child's mouth for a period of 2 minutes. For a conversation, I'll make up a number. So say the child is ticking 50 times over the course of 2 minutes. So the next thing we do is we take a tongue depressor and we put it between the teeth. And I explain all of this stuff to dentist. And now mom's going to count the tics again. And now the tics go from 50 down to 45. And I'll explain the signs in a second. And then we take 2 tongue depressors and we put it in between the child's teeth in the exact same position as the first one, and we count the tics again, and it goes from 45 down to 40. And then we add 3 tongue depressors and we count, and 4 tongue depressors. And at some point, adding more tongue depressors is not going to decrease the tic count. So maybe it goes from 50 down to 35, or 50 down to 30, with four tongue depressors inside there. So now we need to find out, and we take those tongue depressors together, and then dentists will squirt this putty in between the patient's teeth so we know how the top and the bottom teeth go together at that particular distance apart. And then the dentist will take impressions, either analog impressions with the putty inside the patient's mouth, or they can use an iTero scanner and they can scan it and they can send it off to the lab. So now the appliance gets made, it gets inserted into the patient's mouth, and the question always comes is, well, how often do you have to wear it? You wear it as you need it. So if the child's having a bad day, and tics wax and wane, meaning they kind of come and go, the child can wear that appliance when they're having a bad day. They can wear the appliance if they want to go out and go to the movies and socialize with their friends. They can wear the appliance if they're in class. The appliance will interfere with their ability to speak. They have to take it out while they eat. They don't wear it at night. They wear it when they want to try and reduce their tics. And when it works, it's the most amazing thing, and I'm the smartest guy on the planet. And when it doesn't work, then there's a lot of frustration on the child's part and the mom's part. So what does it mean not to work? Well, working is relative, and it's all about managing expectations. What mom and dad really want is they want their child to be cured. They don't want any more tics, and that's what any parent would want. And our appliance will not do that. And in fact, there's no cure for Tourette syndrome at this point. We don't even really know what causes all of it. So the idea that we can cure something that we don't know the cause of is just not going to happen. So if mom and dad want their kid to be Tourette's free, tick free with our appliance, it's not going to happen. So that's the first, managing expectations. If mom and dad are expecting a reduction in tics of 60% and we reduce tics by 40%, we failed. They were I thought it was going to work better. Like, well, it works pretty good, but my son and daughter is still ticking. Yes, we've reduced it by 40%, but I was really expecting at least twice that. It's like, well, we can't do that. We failed. Now, if mom and dad are expecting a reduction of 30% in tics, or just giving their child a little bit of a pause, mitigating the intensity of the tics, and we're able to do that at a level of 40%, and they were expecting 30%, then everybody's happy. So it's really about managing those expectations, which is the most important thing. In younger children that are growing and teeth are, falling out and coming in, sometimes the appliance needs to be remade as often as every 4 to 6 months.
Oh, wow.
Because we don't want to constrict the growth of their jaws, and we want to make sure that we're accommodating the loss of baby teeth and allowing the eruption of the permanent teeth into the patient's mouth. In adults, it's a lot easier. They're not losing teeth. They're not gaining teeth. So we can make an appliance that would last years for them. And so that's kind of how the whole entire thing works. And we've made hundreds and hundreds of these appliances, and we've shipped them all over the world. We've had patients as far as the Middle East and Egypt, and as far south and as Australia, and obviously patients all over the United States and Canada. Many patients in Europe. I mean, the list just goes on and on and on and on and on. And it's an exciting advance in the treatment of Tourette syndrome. It's a big deal. Because what we're doing for these children is we're giving them an opportunity to have more of a normal life, whatever normal means. And that's what we've done, and we're very, very proud of it. And in fact, the lab technicians and Jeff, who actually operates the lab for me, they take an enormous amount of pride. It takes a lot of work to make these appliances. There's not really a lot of profit in it. But knowing that you're helping these children and you're helping these families and you're helping these moms and dads have a better life, it's a really, really big deal. And if I do nothing else for the rest of my life other than this appliance, I know that I've made the world a better place.
Absolutely. Well, thank you very much, Dr. Balanoff, for explaining the process. And I hope that if somebody sees this and needs this, please reach out. He'd be happy to help you. Take care, guys.